today is dog bites in your child. Let's understand that there are a lot of questions which come to your mind when there is a bite from a dog. Let's understand. It may be the question of the dreaded disease of rabies to also a question like whether I should take the vaccine or the injections following a bite on a small puppy. So we shall through this video discuss all the various aspects regarding dog bites. Now, first and foremost, let's understand that in the whole world around 59,000 deaths happen following a dog bite. Understand, alone in India around 20,000 bites have been the reason for death in Indians. Furthermore, let's understand it's not just that the dreaded disease of rabies can be transmitted by dogs, but cats are again a very common source of rabies. Few other animals which are known to cause are cows, buffaloes, horses, sheep, pigs, monkeys, mongoose, ferrets, bears, camels, and so on and so forth. Please understand that rats do not cause rabies, and rabies associated with bats has not been documented in India. Furthermore, let's understand that once there is a bite, there are three major things what we are supposed to do. The first thing being the first aid, vaccination, and then the use of immunoglobulins. Now, we have to understand that after any bite, the chances of transmission of rabies is high because this virus resides in the saliva of the dogs. We have to understand that dogs do not excrete the rabies virus continuously. That is, there is intermittent excretion. So, sometimes you must have heard some faith healers or people telling that I can cure rabies. What actually happens is, for every 5 bites, 1 or 2 people may be spared. Such people, when they go to faith healers, they claim that they have been cured of rabies. So, the point is, there is intermittent excretion of this virus through saliva. Now, coming to first aid, we have to understand this is the most important step in prevention of rabies. Whenever there is a bite, the guideline says that you have to wash the wound thoroughly for a duration of 15 minutes. Please understand, using of soap to cleanse the wound is very important because this soap destroys something called as a glycoprotein membrane around the virus and renders it ineffective. Using of spirit or povidone iodine is recommended, but these may not be available at your house, but a simple aftershave lotion can act in the same mechanism and prevent the complications. So at your home, it is very important to cleanse the wound thoroughly and then take him to the hospital. Once in the hospital, there are 2 things which is assessed. That is, he has to receive 1, a TT injection, a tetanus shot, followed by a vaccination for prevention of rabies. This vaccination is called as active immunization, wherein based on the assessment of the doctor, you might have to receive 5 shots of rabies vaccine. This vaccination goes on from 0, that is on the day of arrival, then on the 3rd day, the 7th day, the 14th day, and the 28th day. So, 5 shots of immunization are required. Why so many shots? Some of the parents ask that let's only take 1 or 2 shots. Please understand that this first, 2nd, 3rd and 7th shot will give you immunity for this episode. The 14th and 28th shot what they do is they generate a memory with which you are protected for a longer duration. So basically by using these 5 shots you are protected for a longer duration. After receiving this, sometimes you are offered an expensive thing called immunoglobulin, that is rabies immunoglobulin, which might cost you 5 to 6,000 rupees, and sometimes for elder patients it might go on for a higher sum. Why this expensive injection is advised is because whenever a vaccine is injected, it enters the body and it takes some time to generate a response, but immunoglobulin starts acting immediately. Please understand that after a bite it might take the virus to start its action maybe in the first week, but during this time your active immunization will not be able to provide you protection, but this passive immunization of this expensive drug called immunoglobulin starts providing you protection immediately. Please understand, this immunoglobulin will be given to you at the site of the bite. So if there are 2 or 3 bites, this injection is injected around the bite, while the vaccination shall be provided on your thigh or your deltoid, not in your gluteal region, unlike the other injections. Now, after receiving the immunoglobulin, the action starts immediately and you are protected for this episode. This immunoglobulin will not be repeated even if there is a second bite in the adjoining period. So, the action starts immediately and it is a single shot. A lot of us have dogs as a pets. So, we are really confused regarding when we have to take these steps. So, an important categorization is done wherein we can understand that when we have to go through the whole parade of doing this vaccination, immunoglobulin, first aid, etc. So, first thing is, if there is licking on intact skin, or you are just feeding the dog, or you are just petting the dog, these are all considered as category 1, wherein you just wash your hands, cleanse yourself, that's it. Now, coming to second category, wherein if the dog scratches, nibbles, or there is an abrasion but there is no bleeding, that is, it is not transdermal, that is, it has not produced any oozing of blood, these are considered category 2, wherein only vaccination is advised. But if there is a bite, single or multiple, which goes through the skin or produces blood, sometimes if there is exposure of the saliva to the mucous membranes like your eyes, your oral cavity, in such a situation it is considered category 3 and you have to take the vaccination and the immunoglobulin, that is the costly injection. Now, apart from this, so many times parents ask whether we can use turmeric powder, some seeds or leaves, or occasionally tie a tourniquet, that is a band, around the bite side. These all are strictly contraindicated. Please understand, the rabies virus enters the nervous tissue. So, more aberration which is created there after using these leaves or turmeric powder, more and more inflammation happens, and this allows the virus to enter or destroy more and more tissue. So all these things are strictly contraindicated. Now, another very important question is, what happens after bite from a small puppy? Let's understand that within the first 90 days, that is the first 3 months, bites from dogs do not cause rabies. There is an important reason for that, because so many times the mother or of the dog is vaccinated and it produces those immunoglobulins and are sent to the dog, which protects the puppy. So also these puppies are usually indoor and there is very less risk that it gets bit from another rabid dog and gets the infection. So until the first 90 days you can be relieved, and very rarely or never the rabies infection happens following a puppy bite. What if pregnant or lactating mothers have these bites? Understand that using of vaccines or immunoglobulin is not contraindicated in pregnant or lactating mothers. Another very important question is, sometimes villages or people ask that the buffalo or the cow was bit by a dog, and sometimes this milk of the buffalo or cow is consumed. Rarely even the meat is consumed. What happens in such conditions? Let's understand that even though there is no documented case of rabies following consumption of milk, still the guidelines say that raw milk and raw meat should be avoided. But there are no risks for boiled milk or the meat which is not consumed raw. So it is not going to provide any problems. Another important question is, what can we do to prevent such a thing? First and foremost, the best step is to train the dogs, and also you have to vaccinate these dogs. So what happens is, during the first year of life of the dog, at 3rd month and 4th month they receive 2 injections, and subsequently every year they keep on receiving a booster dose to prevent development of rabies in such dogs. Now, certain high risk individuals where the dogs keep on biting frequently, or there are multiple dogs and cats, veterinarians, in such a condition where there is high risk of exposure, there is something called as a pre-exposure prophylaxis in the caretaker. In these people, 3 doses of injections have to be taken. That is 0 dose, 3 days, and at 28 days you have to take 3 injections so that you are protected from this dreaded illness. Another very important question is, sometimes people ask that, okay, I am being bitten today and I have taken the vaccine. After some time I get another bite. So in such scenario, what we can do? So in this there are 2 options. That is, 1, if you are taken the vaccination, the full course in the last 3 months, then you don't have to worry. If it is beyond that, if you have taken a complete course, even then you have to take 2 more injections, that is today and 3 days later. But if you have not completed the 5 injection schedule, then in such a case you have to retake all the 5 injections. Now, a very important thing is how to identify these rabid dogs. There are 2 varieties. The first variety is where the dog is excessively aggressive. It produces a lot of saliva, it keeps on barking, and it can bite random things like stones, wood, metal, even those things which it cannot digest. Now, sometimes there is another variant wherein the dog lies down, becomes very lethargic, it sleeps a lot, it doesn't identify its owner, and it can even appear paralyzed. So all of these behaviors can be a part of rabies. So any change of behavior in your dog must make you suspicious of a possibility of rabies in them. Now, coming to the most important part of the video, that is, how can we prevent dog bites? Now, please understand, the first part is, whenever you are buying a new dog, you have to familiarize, get to know the dog, spend some time, only then buy a new dog. Second thing is, there are certain breeds of dogs which are dangerous, like Rottweilers, Doberman, German Shepherd, Mastiffs, Pit Bulls. These are dangerous dogs, and if you have kids at your home, we can preferably avoid them. Certain important things have to be taught to kids whenever you are buying a puppy into the house. First and foremost, we have to teach our kids to respect animals, dogs and other animals also. This behavior goes on a long term in developing his character. Another important thing is, we have to tell them that you should never approach an unfamiliar dog. If a dog is attacking you, then you should not scream and run, but stay motionless like a tree or a log so that it sniffs and understands you. Another important thing is, if at all the dog starts having abnormal behavior, then this has to be reported to your parents. Or if there are any bites or scratch from a dog, then you should tell your kid that he should come and inform it to you. You should ask your kids to never throw stones at the dog and never ever disturb a dog which is sleeping, feeding, or nursing its puppies. These are the most dangerous times. I think these are some of the basic things which, if we teach our kids, then they will be prevented from dog bites. Now, these are some of the most commonly asked questions which I have felt through my practice. There are a lot more questions which are slightly rare, so they are not addressed in this video. But you are free to mention those questions in the comment sections. I am there to clear your doubts. Hope this was informative. Thank you.